Hello and welcome back to the channel. I'm Chelsea Brown, physical therapist and concussion specialist. In today's video, we're going to cover acute concussion recovery. So what is that? That's the first 24 hours to about 2 weeks post-concussion. So if you or a loved one has recently sustained a concussion, this video is going to be helpful for you in knowing what to do, what not to do, when to seek medical attention, and what to do if you're just not getting better. We're trying to uncover those murky waters of rest, but don't rest too much. Do something, but don't do too much. So if you're confused about concussion recovery, this video is for you. So first things first, we want to rest, but we want to make sure we're not completely shutting down the system. So again, gone are the recommendations of dark rooms, no activity, just like completely shut down. We want calm, but not comatose. We want a little bit of activity, but not a ton, right? So that can be kind of confusing. In the first 24 to 48 hours, we want to limit our screen use, decrease heavy physical activity, and really just find a state of calm so that the brain can have a little bit of stability and some space and time to heal. So that means no doom scrolling, try to get off social media, spend less time on your phone, really decreasing screen time, decreasing the amount that you're watching TV. So audiobooks, podcasts can be really helpful here. Finding calm, mindful activities that really just give your body a little bit of a break. Offloading cognitive activities and decreasing multitasking where able can be super helpful in this first couple days of your recovery. So just giving your brain some space and some time to heal. Note that this is really only helpful in that first 24 to 48 hours where we're kind of really shutting things down almost to nothing. After that initial period of the first 24 to 48 hours, staying in this total rest state can actually slow down the process. So before we keep going though, I really want to touch upon our red flag signs. So red flag signs are things that you need medical attention immediately. Most of the time, the reason why people need medical attention after a concussion is due to suspected brain bleed. So we want to have imaging to rule out that there's a potential for a brain bleed. Signs and symptoms that would be considered a red flag are the following: severe and significantly worsening headache, repeated vomiting, slurred speech, or continued excessive confusion, unequal pupils, loss of coordination or significant balance deficits, weakness and or numbness in the arms or legs, seizure-like activity, significant drowsiness, or inability to wake. Note that these do not necessarily mean that a brain bleed is present, but they are significant and warrant medical attention immediately. All right, so now that we've got our red flags out of the way, in the first 24 to 48 hours where you've done most rest has passed, now you're like, okay, I'm supposed to keep resting, but I'm also supposed to do something. But what do I do? How do I know if it's the right amount? How do I know I'm not doing too much? Where do I start? So the first thing we're going to start with is light physical activity. This is sub-symptom threshold. So ideally our light physical activity is just enough to get the heart rate elevated, get a little blood flow moving through your body, but not something that gives you significant headaches, lightheadedness, dizziness, nothing that's ramping up those concussion-like symptoms. Light activity for me might look different for light supportive activity for you, and that's okay. So note what your friend did post their concussion might not be the right thing for you, and you need to listen to your symptoms in your body as a guide and not listen to what somebody else did and how they experienced their recovery. So when we're looking for that slight elevation in heart rate, low symptom guided cardiovascular activity in this bucket can be light walking, stationary or recumbent biking, swimming, a little bit of yoga or stretching, things that are calming and feel supportive to our nervous system and our body. You want to use your symptoms as a guide. So if you get a spike in symptoms, that is okay as long as it's in that about 2 to 3 out of 10. And when you're done with activity, the symptoms don't linger with you for a long period of time. You're able to rest, recharge a little bit, and then you can go about your day and still do other things. If the physical activity that you are doing is completely exhausting you, where you have to sleep for multiple hours, you feel totally exhausted, can't complete any other activities for the day, that is too much for you and you need to dial it back. The purpose of this light activity is just increasing blood flow throughout the body. That is going to help with the healing process. If we push too much, it's going to be detrimental to the healing process. So it's all about finding the balance and using those symptoms as a guide to help you. If you need more guidance on how to use your symptoms as a guide, check out my video on the stoplight theory, which will help guide you and how to pace and understand if an activity is appropriate or not for you, depending on where you are in your recovery. We're going to continue with now slowly ramping up cognitive activity. So initially post-concussion, we want to decrease cognitive stimulus where we can. Offloading activities and responsibilities to others in our household can be super beneficial. But then we want to slowly ramp those things back in, right? We want the brain to fire because that is going to help with healing. So we want to initiate some of those motor pathways that are associated with cognition. But you want to do it in a light and controlled manner. So doing a cognitive activity for 10 to 15 minutes, like answering some emails, doing a little bit of computer work, maybe responding to a couple of text messages. And then you want to take a break, right? So we want to slow drip that cognitive activity. Maybe this is a place where you start to read a little bit, pick up that, book you wanted to read for fun, but set a timer. Only read for about 10 to 15 minutes, see how you feel, take a 5 to 10 minute break. If you're still feeling good, go back to it. Right, so we're going to continue with cognitive activity as well as physical activity of using our symptoms as a guide. We don't want to then just jump back into a full day of work or a full day of school and come home and be like, oh my God, I overdid it. That was way too much. My brain feels super overwhelmed. We want to have these intermittent periods where you're checking in with yourself. You're seeing how you feel. You're seeing if your symptoms are elevated so that we can stop before it becomes a problem, before we push past our capacity and past our limits and hindering that recovery. It's going to take time. There are going to be times where you do push a little bit too much, but that's going to be something to realize, acknowledge, and stop yourself next time before you get to that point, because repetitively doing that is where we're going to see our recovery plateau in progress. So how else can we support our recovery besides pacing physical and cognitive tasks? It's going to be through our sleep, hydration, and nutrition. These are going to be vital for helping you to recover. Sleep is really important. You want to sleep when your body feels like it needs to rest. So don't try to limit the ability or time that you're sleeping. Sleep is your body's natural recovery system. So you really want to support natural sleep cycles. So natural sleep cycles are really, really important. We want to try to be getting to bed at a consistent time and waking at a consistent time. We want to support that, but you might need more sleep than you would previously. So you don't necessarily want to prevent yourself from napping if your body needs that rest. You just want to make sure that the naps that you're doing throughout the day aren't hindering your ability to sleep at night. So if that is you, if you find that when you nap at the day, you can't go to bed at a usual hour, maybe you cut those naps during the day shorter, or you limit your ability to take a true nap after, say, 2 p.m. And that's finding the spot for you where napping too late becomes harmful. So some people can take a 2 or a 4 p.m. nap and still go to bed at about 10 o'clock. But if that isn't you, you want to make sure that you're prioritizing sleep at a normal sleep time, right? So that we're having that normal circadian rhythm. The body is getting the recovery that it should get at night, but extra sleep is okay as long as that nighttime sleep is happening. Things that can really help this is prioritizing a consistent bedtime routine, limiting screens at nighttime, especially about an hour before you're going to go to bed, to really help send signals to the brain that it's time to shut down, time to turn off. Some calming or meditative breath at night can also be really beneficial to supporting parasympathetic drive and allowing your body to get into a rested state so you can get good, restful sleep. Hydration and nutrition can also be really supportive in your recovery. So we want to make sure that we're hydrating, we're getting enough water. Sometimes adding some electrolytes in can be really helpful if you are feeling like you're drinking a lot of water but still feeling dehydrated. That electrolyte balance allows our body to actually utilize that fluid to having more blood volume available so that the brain gets the nutrients that it needs to heal. You also want to make sure that you're prioritizing nutrition. Oftentimes I hear, well, I'm not doing a lot, I'm not really hungry. Your brain needs fuel to heal. So prioritizing protein, complex carbohydrates, healthy fats, omega-3s, things like that will really help with building of new cells and brain recovery can be super beneficial. Some things that you might notice is that having too much simple carbs will give you significant blood sugar spikes, and then you will feel those energy declines off of the blood sugar. So you want to make sure that you're balancing a nice healthy meal with protein and fats when you do have some of those carbohydrates so that your body is able to utilize them, but it maintains a steady blood sugar. If you are noticing that you're light or noise sensitive, you can use ball caps or earplugs to really help with that, but you want to allow yourself some exposure to noises and lights so that you don't become super sensitive to them over time and have a really hard time reintegrating. So having intermittent exposure to those stimulus can be helpful, and then when it becomes too symptom provoking, either remove yourself from that situation or add some of those protective strategies, ball caps, sunglasses, things like that. Ideally, you want to avoid wearing dark sunglasses inside, as that can make you more sensitive to light over time. Okay, so that covers the basis of what to do in the first about 2 weeks of your recovery. But what happens if your symptoms last longer than that? A lot of times this is common. Symptoms will last longer than 2 to 3 weeks. I know a lot of the research says 2 to 3 weeks for symptom recovery, and honestly, that mostly just covers our sports-based concussions, and that's not where everyone sustains a concussion, and that is not well representative of the entire population. So a lot of people will experience symptoms beyond 2 weeks, and if that is you, know that you are not alone. But there are answers. Early guidance from a physical therapist or rehab specialist can make a huge difference in your recovery, so don't delay. If you are still experiencing those symptoms after 2 weeks, I would schedule an appointment with somebody so that they can help get you back on track. Remember, recovering from a concussion does not mean staying in a dark room for 2 weeks. There are plenty of things that you can start to implement in those first 24 to 48 hours after injury. With the right balance between rest, gentle movement, and re-engaging in activity slowly over time, your brain can heal more efficiently. If you found this video helpful, please give it a like and subscribe to the channel. And I have more videos on early concussion recovery and pacing that you might find beneficial as well, so check out the channel for those. Remember, take your recovery one day at a time. No concussion is the same, and everybody's recovery will look different. Hope you have a great day. Bye-bye.